Welcome everyone to our press conference. My name is Gordon Friesen. I am president of the Euthanasia Prevention Coalition, and we're here today to talk about Bill 314, which has been introduced by the Honorable Ed Fast, the intention of which is to state that mental illness as a sole underlying condition would not qualify patients for euthanasia. Just a moment of background on that. In 2021, there was a bill C7 which extended the practice of medical aid in dying or euthanasia to people who are not at the end of life, including people who have mental illness. And thus, the idea was that there would be euthanasia for people whose sole reason was mental illness. Now, at the present time, there's public support of about 30% for that proposition. In fact, we would not be in the euthanasia situation we're in today if it was not for the province of Quebec. And the End-of-Life Commission in the province of Quebec have explicitly rejected euthanasia for mental illness. So there is a strong opposition to that proposition, and Ed Fast has introduced a bill saying precisely that mental illness cannot be a sole underlying condition. Today we have two ladies who are going to speak about their personal experience with the situation and with the possibility, with the danger, the discriminatory danger of MAiD. And we have Dr. Paul Saba, who is going to give us the perspective of a physician. Thank you very much. I'll begin with Anika Morrison.
Hello, everyone. My name is Anike, and I live with a serious mental health condition. And I'm in support of Bill C-314, and I'd like to just share my story with you and how the bill would affect me and my community. So in 2014, I lost my brother, and I have never been the same since. I've gone through several traumas and stressors since then, culminating in a range of serious mental health symptoms in 2018. That year, I was hospitalized 5 times, one time for 5 weeks, including a stay at the acute psychiatric unit. And it was one of the worst years of my life. When I was discharged, my father had to keep my medication in his room to keep me safe. And at one point, I was so depressed I didn't leave the bed or the couch for weeks on end, leading to my sister becoming so concerned that she called the ambulance. If MAiD had been presented as an option to me at that time, as a solution to the emotional pain and distress I felt, I may not be here today. It was a really rough time, and it's only the care of the psychiatrists, psychologists, pharmacists, social workers. It's only through their care at the hospital that I was able to get better and move through that time in my life. And since then, I've completed my undergraduate degree, I've traveled, I've gone on a mission trip, and most importantly, I love my life, I enjoy my life. And I feel as though I'm on the other side of that dark period. With Bill C-314, we would be reversing the decision to extend medical assistance in dying to people whose sole underlying condition is mental illness. We know that it's not a possibility to predict whether someone with mental illness will become better or worse. Psychiatrists can't predict it, and oftentimes we put an emphasis on suicide prevention measures for people like me. Talking to a friend, asking them if they have a plan, being there for people that we notice are acting differently. All of these suicide prevention measures, I think, are what we need to emphasize when it comes to care for vulnerable people. And as Canadians, we can't do both. We can't put our emphasis on preventing suicide while also presenting MAiD as an option for people with mental illness. This bill would also reverse people who are experiencing poverty or homelessness or PTSD or who have a disability. This bill would prevent them also from seeking medical assistance in dying, which I think is incredibly important. And so I hope that Honorable Ed Fast's bill passes and that we will not see this extension of MAiD to people with mental illness in March 2024. Thank you.
Now we're going to hear from Leah Limuson.
Thank you so much. Well, hello everyone. My name is Garafaya Malusas. Thank you for the introduction, Gordon. I am 27 years old. I am a lawyer, and I've struggled with depression for over 10 years now. Gordon talked about Bill C-7, and I, as a lawyer, had been working to advocate against the expansion of euthanasia to include individuals whose only underlying condition is a mental illness. And after working tirelessly on the legal front, eventually I felt like there was nothing else I could do professionally, and the only thing left was for me to share my story. And so even though, mental illness is extremely stigmatized in our society, and even though as a lawyer, there's particular stigma, I chose to write a letter to every member of parliament and every senator indicating that I was opposed, as an individual who lives with a mental illness, I was opposed to the expansion of euthanasia-assisted suicide or medical assistance in dying. I want to explain a little bit about my story, because I've heard it said, you can argue with statistics, but you can't argue with a story. And so my story started when I was about 15 years old, and there was really no trigger point or particular trauma that led to me struggling. It was kind of just a descent into darkness, and I often describe depression as the world just losing its color. And that period lasted for, that first period lasted for about 6 months. But in that time already, it was I started struggling with self-harm, with anorexia, with bulimia, and it really felt like it would never end. But when it did, I thought, that's great, I'm done. This is over. And I even bought myself a little plaque with a motivational quote just to celebrate the fact that I was done and this was over. And then it happened again and again. And every year I struggled with intense depression, and I calculated it at one point, and I realized it was taking about a third of my year every single year. And what was so hard for me was that it was amorphous. There wasn't a specific physical location that, needed a remedy. It was this amorphous pain that felt like it would never end. And so I started reaching for some kind of coping mechanism to give me more control. And that's why I reached for things like self-harm and an eating disorder. And as many people know, when you start reaching for things like that and you start experiencing addiction, you're not the one in control. The addiction is now controlling you. And so when I then started trying to recover, I found that I couldn't. I think my first time trying to recover, I lasted 85 days before I relapsed. And then every time it was shorter and shorter. And I got to the point where I figured, I'm not going to be able to recover this. I will never get better. I'll just have to live with this for forever. And so facing down the prospect of, the rest of my life being, 1 year after another of amorphous existential suffering, I figured that death was my only solution. And so I first attempted suicide when I was 15 years old. And I attempted suicide 7 times in the 2 years of particular acute pain, although the depression and the struggles with mental illness continued long after after that acute period. I never sought treatment, and if you had offered me medical assistance in dying in that moment, I would have taken it, because I really genuinely believed that death was the only solution to the suffering that I experienced. Unless you've experienced a mental illness, it's hard to understand how patronizing it is to hear people try to distinguish between medical assistance in dying and suicidality. The argument is that people who are suicidal, irrationally suicidal, just really want to die, and that's the motivation, whereas people who want medical assistance in dying experience suffering and they want that suffering to be relieved. And yet, if you had told me when I was 16 years old that I could live the rest of my life without that suffering, I would have taken that. Death was not something I pursued because it was what I wanted. It was something I pursued because I thought it was, the last-ditch solution to the amorphous suffering I was experiencing. And that's no different from the fact that, Kay Carter, Nicole Gradieu, and Jean Truchon thought that medical assistance in dying was the solution to their suffering. suffering. So really, any delineation between the two is nonsensical. It doesn't make sense. And we've almost recognized that now because we've expanded euthanasia and assisted suicide. We've expanded medical assistance in dying to include individuals whose only underlying condition is a mental illness. And I've watched society debate this very academically, but I would ask people to consider how that will impact individuals like me, individuals like those who are here today. The reality is we know that mental illness disproportionately impacts marginalized populations. It disproportionately impacts women, indigenous populations, racialized populations. And so while our government has said, let's just extend medical assistance in dying and provide it equitably, identically to all individuals who experience suffering, it's important to remember that a truly equitable society is one that accounts for the unique vulnerabilities of marginalized populations. And so what individuals like me and Anika, and I apologize if I said that wrong, what we need is greater protections and support. We do not need someone to come alongside and say, we will help you die. We need someone to say, we'll help you stay. Life really does get better. And so I would ask people to consider that, to hear the stories of those who experience mental illness, to speak to those in your community who experience mental illness, and to really think about what it means to be offering suicide assistance to those who need suicide prevention. Thank you.
Thank you, Leah. We're going to hear now from Dr. Paul Saba, who will speak to us from the point of view of a physician.
Yeah, as a family physician, I stand in the front lines with my patients who suffer from all types of illnesses, including mental illness. Approximately 1 in 5 people will experience mental illness in their lifetime. Less than half will seek professional help. Over 4,000 Canadians commit suicide every year. The recent COVID pandemic increased depression amongst Canadians, and the greatest impact was on marginalized, including young adults, the poor, those with pre-existing mental health conditions, Aboriginals, women, and those who are discriminated against based on their sexual orientation. The family doctor is often the first point of contact with someone with mental health problems, and over 50% of those go to their family doctors. However, there's a problem. We lack family physicians. We lack also psychiatrists and psychologists who support our patients. Our healthcare and our social system is deficient for people with mental health problems. On average, in Quebec, the average waiting time is 5 months from the time of referral to a psychiatrist and to treatment. And in the law, they're talking about a 90-day waiting period, so people won't even have had a chance to meet a psychiatrist. And that doesn't mean that if you give them a psychiatrist, that will solve all their problems. I often counsel patients with suicidal thoughts. During the pandemic, I had many, many calls from young patients who were in great distress, great anxiety, and I spent many hours counseling. I even have older patients who hold on because of reasons that I try to convince them that there's reasons to hold on, including one patient who has a young granddaughter. There's always a reason to live. But as caregivers, we have to find that reason for people who want to live. We have to find that reason. No one really wants to commit suicide. People just want to end their distress. In most cases, the desire to die is a symptom of mental illness. Studies show that at least 90% of people who end their lives were affected by a mental disorder at the time of suicide. Studies also show that most people who've attempted or completed suicide do not necessarily want to die. Rather, they want to escape their overwhelming emotional pain. According to a study at Harvard, 9 out of 10 people who attempted suicide but were unsuccessful in their attempt did not commit suicide following treatment. So if they survived and they got treatment, 90% said, no, I'm not going down that road. Suicide disappeared. Most psychiatrists do not support the legalization of euthanasia for the mentally ill because of their concerns for vulnerable patients. And also, as we heard earlier, that you cannot decide who is irremediable. From a legal standpoint, and we had our lawyer here today, also a lawyer from Montreal, Natalia Manoli, has stated categorically at hearings that mental illness does not meet the condition for free and informed consent for medical aid in dying. The more a person struggles from mental illness, the less apt they are able to give free and informed consent. We have a responsibility here in Canada to improve our healthcare system, which is grossly insufficient. The federal government needs to come up and give more than they presently are giving. The provinces are asking for 30%, and we've giving a measly 22%, the federal government. We have to improve mental health care, including access to psychiatrists, psychologists, and social workers. By doing and expanding medical aid in dying to the depressed, they're finding a quick and easy solution to get rid of people with mental health disorders. It's nothing else but killing those who need to be cared for. We must ensure affordable housing, adequate food security, and for people who have physical pain, all the treatments, including physical therapy, which is not accessible in the public system for people outside the hospital. We must become a society that cares for people with mental health problems rather than killing them. People with mental illness must not be euthanized. I just want to say a few words in French. Au Canada, nous avons la responsabilité d'améliorer notre système de santé pour les personnes atteintes de problèmes de santé mentale, y compris un accès rapide à des psychiatres, des psychologues et des travailleurs sociaux. Nous devons également garantir un logement abordable, des revenus adéquats pour se nourrir, des traitements adéquats pour soulager de douleurs physiques et psychiques. Le Canada doit devenir une société qui offre les meilleurs de soins à sa population, pas de les éliminer. Les personnes qui ont des problèmes de santé mentale doivent être soignées et guérir. Ils ne doivent pas être euthanasiés.
All right, I have no questions in the room. So for people joining us on Zoom, this is just a reminder to use the raise hand function if you have a question. Pour les gens sur Zoom, ceci est un rappel d'utiliser la fonction main levée si vous avez une question. I have no questions on Zoom. This concludes the press conference. Ceci met fin à la conférence de presse. Merci beaucoup. Thank you very much.